as promised, 35 different industries, an expert from each industry. They're going to help us through the challenges, the hardship, and yes, even the opportunities. And today, our experts come from the insurance industry because obviously there's so many questions, so many things happening. And of course, I've got two of the leading experts. I've got somebody in individual health insurance, Annelies. How are you today?
Very well, how are you?
Great, great. Thank you for joining us. And in group insurance, Craig Murphy. How are you today?
Good.
Thank you guys. Thank you guys for joining us. Welcome to Expert35. Annelies, tell us a little bit about what you do and how you help, just so that people know a little bit more about what individual health insurance is.
Yeah, so I help individuals, families, and self-employed people with health insurance, good coverage at affordable prices. Really, what else is there to say? So with, especially right now, health insurance is just very critical and that everybody has it, at least for catastrophic. So that when you get hospitalized, whether it's due to a car accident or or through this COVID virus, it's just so important to make sure that you have that kind of coverage, because otherwise your out-of-pocket expenses will be pretty high.
No, I bet. And Craig, tell us a little bit. Oh, real quick, I'm going to plug you in. If you text Expert24 to our Textify number, you'll get all of Annelies' contact information and some of her free giveaways that we'll talk about at the end. Craig, tell us a little bit about the group policies.
Sure, and I basically pick up where Annelies leaves off. I offer health insurance to groups, which it basically consists of 2 or more employees. Our average group probably is about 8 to 12 employees. We provide not only health insurance, but a range of other products, but primarily focused today is the health insurance. It's important to have coverage for not only your employees, not only for their health, but also for just to attract and retain the best employees.
Right. So one of the questions that we're saying is the quick plug-in for you. Actually, 15, you'll get Craig's information. You'll also get access to some of the previews we'll talk throughout the show. If you text Expert35, you can join the conversation. Really, today is, we're in interesting times. And a lot of people are saying everything's changing, rules are changing. Annelies, what trends are you seeing?
There are more people actually looking for health insurance. And I also come across, people are really start to look more in what they have as health insurance, and sometimes are very surprised of the coverage that they have. There are people out there that have been sold different type of insurance that doesn't cover the current situation.
And Craig?
I would say that, we've got a combination of people who are looking for their coverage continues to go up in cost, and so they're looking for alternatives that are still within their budget. We're also seeing some people, unfortunately, who are having difficulty paying their premiums at all, and so we're kind of working a double front where not only are we helping them with the insurance, but just how to retain the insurance that they have.
Interesting. So and there's shifts, right? There's laws that are changing. There's the people are really scared, right? Yeah. And one of the questions that we have a lot of users asking, saying, like, is this a good time to change, to even go through the process of changing coverage? Annelies, you want to chime in on that, on the personal side?
It can be, not in all situations. So people that have more challenging pre-existing conditions, that may not be the good time to change your private insurance, because oftentimes there's a 12-month waiting period to get treatment on your pre-existing conditions, not for new conditions, but your pre-existing. But for people that are healthy, definitely go shop around, talk to multiple agents, get different quotes from different entities, from a broker. To really, start to understand it and compare plans.
And Craig, what are you seeing on the business side?
Well, we're seeing actually that it's business as usual. We're seeing clients that are making decisions to change plans, and because of group insurance is a little bit different in that in many cases, if it's a fully insured type of coverage, there is no pre-existing condition clause. So that isn't really a problem. We've done numerous meetings online using Zoom or just a call where we talk to the employees so we can enroll them. The paperwork's handled internally with electronically. So we're seeing that the implementation of groups going pretty smoothly at about the same rate that we would normally see, maybe even a little bit faster because not everybody's changing. So and really on the group side, it's business as usual.
Interesting. And we actually have a chime in from a guest. They're saying with the shutdown, are qualified events or special enrollments being affected? Is there any change to that on the personal side, Annelies?
Yes. So people that have lost their job, that is life qualifying event to get on the Affordable Care Act plans that I also help people with. But with the private insurance for individuals, there is really no need to have a qualifying event. And there is no special enrollment. So we just go through the personal and health situation and actually see what kind of plan you can get today.
Is there any effects on the business side at all for that, Greg?
Yeah, well, there is, but it's really using an existing rule or law regulation in that employees that say had their own insurance, if they lose their coverage right now through their employer, if they have a spouse, then they are eligible to join that plan as a special event, allowing them to join the plan with no problem, even if it's during the middle of the year. So definitely that's something to consider.
Yeah, so more or less we're saying is there are options out there, even though there is not even a live qualifying event, special events like now.
Perfect. And another question that we've had actually beforehand, this isn't a live question, but is how many, many have lost their job. What is available, right? If they don't have, they can't, the stimulus check isn't going to necessarily cover all the premiums. Like, what are options available for them?
You mean in the insurance plans?
Yeah, in insurance plans, like, is there ways that they can, change their plans? Can they get better? What should they hold on to? Like, what would you say back to that?
Yeah, so there are people that lost their job and now on COBRA, for example, that can be pretty expensive. But even people with a lower income, private health insurance is really the way to look into that and compare with the ACA plans, the Affordable Care Act plans. But I also always go through the different options that they have and compare them and show them and really inform them so that they make the right decision that works for them, whether it's from a premium perspective. And, the Affordable Care Act, there is subsidies included as well if you have a really low income. So, but that's.
Oh, I just lost you. I think we lost you a little bit there. What's going to happen next? So, Craig, you want to jump in on that and see, tell us which way the industry's heading?
Well, I think that, we've been fortunate on the group side. Most of the insurance carriers have been really generous in terms of allowing clients extra time to make their payments on their premiums. They understand that there are many companies that are shut down and are really not bringing in any revenue at this time. So, kudos to all the major carriers. They're allowing delays on premium and payments. Mm-hmm. They're also generous in terms of some of the benefits towards covering COVID virus. Depending on the carrier, some of them are covering COVID virus in full, so the member doesn't even have to meet a deductible or have any copays associated with that.
Interesting. And that just happens, or is it each company individually does that?
It is. And, you're welcome to talk to me or to your current insurance broker. They can tell you what their current coverage is, but whether it's Blue Cross or United or Aetna, any of those, but even other self-funded groups, third-party administrators, they all have their own policies. It's not a uniform one-size-fits-all. It's all from carrier to carrier.
Right. And Annelies, you want to chime in on what's happening next? Like, where are the trend going?
The trend really is get to know your insurance, understand it, know where to go as well. I mean, I come from a really corporate environment, and it's also about know where to go in case there is an emergency, right? So you have your coverage, you have all that, but urgent care is so much cheaper to go to than, for example, the emergency room. But the other real trend right now actually is telemedicine. If your current plan doesn't have telemedicine, it is a valuable tool, but you can just get off the market for just the telemedicine part. Because if you're really sick right now, and I mean, I live by myself, who do I call for, right? And yes, I have friends and I have maybe family in the area, but the telemedicine app really helps quick diagnosis or advice on what to do, where to go, get prescriptions. So it's that's a big trend at the moment, and a vital service.
Can you just add that, or okay?
Can I add on the groups? Yeah, I would say that telemedicine's been around for nearly a decade. They relaxed regulations about 10 years ago, but it's really coming into its prime right now because, the last thing you want to do if you are feeling sick and you're not full-blown COVID virus, the last thing you really want to do is go sit in a doctor's office or go to an emergency room. The first step is to use the Teladoc or any of the other brands of telemedicine. Many of the carriers also, even when there was a copay associated with the visit, some but not all are just waiving those copays so that to encourage people to make the phone call rather than going out into public and possibly either getting sick or spreading the virus.
So that's a very important don't, right?
Absolutely. I would say, know your benefits, know if you have it, and take advantage of that. It's sometimes it requires you to download an app on your phone or to register in advance. So you don't want to wait until you're running a fever and you feel terrible to start the process, because sometimes there is a short setup before you actually can go live on that.
Well, and the other benefit to telemedicine it's for the family. It's not just for the person that purchased it, it's for the family. So even people that can't or think they can't afford health insurance whatsoever, but they want that kind of advice, or they need a prescription for something at times, it is a really valuable tool to have in your tool belt.
Yeah.
Perfect. So
now you have to be patient now because there's waiting lines are long, even when you're online, but yes.
Perfect. And so that's a perfect transition to my favorite part of the segment for Expert35 is 3 things to do now. So we said don't go to the emergency room, right? You probably get more sick there than no. So let's talk about the do's. So tell us, Annelies, starting me off with 3 things that you can do now that you should start doing now.
So on a first of all, try to stay healthy, right? Drink enough water, sleep, get your vitamins, nutrients in. No, not all grease food, maybe. Second of all,
we should listen to Shauna because she gave us a whole spiel on how to be healthy.
Correct. But I mean, first it stays with yourself and try to be healthy, as well as listening to the CDC advice. Cover your mouth when you're and use all these hand sanitizers to clean yourself off for the viruses. But then the other thing is know your health coverage. Have the health coverage card with you or in your wallet, but understand it and that's really
review it and that's something you offer, right? You give a free review.
Correct. So I'll do like 12 a week, just a 15-minute quick review on your health insurance. We can talk about it, see how it works, how much you maybe get out of pocket, but then also just to help people realize, are they currently covered sufficiently when they get hospitalized, for example, because this is a scary virus.
So I just put on the screen, Expert24, text that, you'll get access to a review and explanations and with Annelies. Thank you for that. Now, Craig, your turn, the best part of the show. 3 things, 3 do's. What should we start doing now?
I would say, depending on the type of business, we have clients that are either frantic because they're an essential business, they're busier than ever. We also have clients that are somewhat they don't have as much to do because their business is not open right now. So I would say, look at this is a great time to evaluate your benefits. It's one of those things that I know insurance is, for not everybody, it's not the most exciting thing in the world, but I would say take the time to understand your benefits. If you're unhappy with your benefits, now is a great time to have the conversation with your broker, your consultant, your agent, to find out what the alternatives are. The second thing I would say is there are other alternatives than your standard fully insured health coverage through one of the major 3-4 carriers. There are some other options that are a little bit more creative. It's not a fit for everybody, but if you're willing to take some steps to look beyond just the generic coverage, some terrific benefits. I would say, this is a great time because I think everybody is aware of their vulnerability. The 25-year-old guy who thinks that he's bulletproof, maybe he realizes now that he might actually need health insurance one of these days because he's been inundated with all that's going on in the news and happening around him. So I would say be willing to consider alternatives. Have a conversation with somebody now, and be willing to make some changes. If you're we can save people sometimes significant amounts of money, as much as 30% lower premiums if they actually look at alternatives.
And this is a great time to kind of plug you a little bit. Expert15, text it to that number. You'll offer a full consultation, right? And,
absolutely.
And then you also have a newsletter that gives you kind of up-to-date information on laws that are changing, benefits that are available, right?
Absolutely.
Well, guys, thank you so much. We've got a couple. People are chiming in saying thank you for this information. We're going to post some of that information as well, and some of the links, like Annelies said, some of the links to the CDC that are helpful. We'll go ahead and put those in there. You've joined us at Expert35 with Craig and Annelies. This was do's and don'ts to stay safe. If you want to learn more, if you want to follow the conversation, text Expert35 to the number on the screen. You'll get access to our experts. We'll keep the conversation going. We've got new episodes tomorrow. We're going to talk about wine, do's and don'ts as well about wine. And Wednesday we've got real estate. So we've got some of our real estate experts coming on market. So again, guys, thank you so much. It was super helpful. Great having you guys on the show. I'm glad that I guess you guys are. What do they call them? You guys are essential businesses. So you guys are out and talking to people, but as you can tell, we're the rest of the world staying home. So,
we're doing it from home.
Thanks a lot, guys. Stay safe. Be well. Thank you for joining us.
Appreciate it.
Bye.
Bye-bye.